Good evening, everyone, and welcome to the December edition of Glaucoma Australia's live Q&A webinar series, which is proudly brought to you by our long-standing and generous supporters at Glaucos. My name is Natasha Sickman, and I will be your host tonight. I am one of the senior orthoptist patient educators here at Glaucoma Australia, leading our organisation and the valuable services that we provide to our glaucoma community. Before I introduce you to our wonderful guest speaker tonight, I would like to take a moment to acknowledge the traditional custodians of the lands, skies and seas in which we collectively gather for tonight's event, and I pay my respects to the elders past and present, along with their emerging leaders. Tonight you will hear from Dr Bernardo Soares, who will be presenting on a very interesting and sought-after topic of exercise and glaucoma. Dr. Soares is a Melbourne-based ophthalmologist and experienced eye surgeon specialising in cataract and glaucoma surgery. After completing his medical degree in both Brazil and Portugal, Dr. Soares underwent extensive ophthalmic training across Brazil and Australia. He completed fellowships in glaucoma in Brazil, followed by fellowships in glaucoma and advanced cataract surgery at the Royal Victorian Eye and Ear Hospital in Melbourne, where I've had the pleasure of working alongside him. Dr. Soares holds public positions at the glaucoma unit at the Royal Victorian Eye and Ear Hospital and serves as the glaucoma lead at Monash Health. He is passionate about complex glaucoma and cataract surgery, ophthalmic education, and the surgical training of future colleagues, as well as advancing glaucoma collaborative care. He has numerous publications in peer-reviewed journals and regularly presents his work at both local and international conferences. Dr. Soares also sits on the RANSCO Council and is a member of the European Glaucoma Society, as well as the Australia and New Zealand Glaucoma Society. So without further ado, please join me in warmly welcoming our guest speaker, Dr. Bernardo Soares, tonight. So over to you, Bernardo.
Thanks, Natasha. Thank you for the very kind introduction. And thanks for everyone who's logging in now at a very busy time of the year in December. Hopefully everybody's got their Christmas preparations on the way. And thanks for asking me to speak on this topic, glaucoma and exercise. So I'm going to cover a few evidence-based guidelines on, how we do exercise and go about our daily lives, particularly with patients living with glaucoma. I often get asked this question in the office, normally right at the end of the consultation: what else can I do? I'm already, taking drops, or I've had laser, or I've had surgery, or I'm just monitoring my glaucoma without sort of any treatment at the minute. But is there any lifestyle changes that we can cover? So glaucoma is a very complex neurodegenerative disease, and normally we focus on bringing the pressure down, but we always want to modify those lifestyle factors like physical activity, which we're going to focus on throughout patients' long-term care. I'm not going to touch on supplements and neuroprotection, which Jonathan covered that back in September. So we're going to focus mostly on exercise. I'll cover some aerobic exercise, resistance and strength training, safety and safe training protocols, some postural risks with some practices, in particular yoga. I'll suggest some safe postures that we can replace with standard postures in yoga, and as well as breathing practices, mostly in yoga as well. So a good motto overall for glaucoma is: if it's good for the heart, it is good for your glaucoma, and if it's good for the brain, it's good for your glaucoma. So aerobic exercise, we're normally just brisk aerobic activities. A lot of the data, we've got very good data that shows that 30 to 40 minutes a day, 3 to 4 times a week, lowers your intraocular eye pressure, short and long term. And that's just walking, you're walking the dog, or swimming, or cycling. Even if you're doing it on a treadmill, that works. An interesting study found that people that are completely sedentary, that don't do any workouts, if they start doing a bit of walk, those are the ones that benefit of it the most. So I'm always interested to see what sort of physical activity, in particular, the patient is already using. And if they're not, I try and use that statement to incentivize them to starting at least going on a half an hour walk 3 times a week. The aerobic exercise has a powerful effect on neuroprotection. And this interesting study looked at people that on average walked 5,000 steps a day. If they increased that to 10,000 steps, so they went to extra 5,000 steps walked, or about 2.5 hours of not sitting still, as well as 2 hours of moderate to vigorous exercise that is a week for the exercise, although the steps are a day, they had significant lowering of the intraocular pressure. The benefit went beyond the pressure control and is also slowed down the rate that they lost the visual fields. So when we're doing that test with the visual field loss, we're always worried that that's progressing. So exercise does help reduce the rate of that getting worse. And that for about 10%. So 10% alone, which is normally if you're putting one eye drop or if you're doing a laser as a first line treatment, that might reduce your pressure from about sort of like anywhere between 15 and 20%, but exercise is almost as good as one single treatment. So all those methods, walking plus 5,000 steps a day, having 2.5 hours of non-sedentary activity throughout the day, that's just moving around or sitting on a chair or watching TV, or at least sort of like 2 hours of moderate to vigorous exercise, that also reduces the pressure at about sort of like 10% and reduces the rate of visual field loss at about 10%. So that was for aerobic exercise. Now I'm going to focus on resistance and strength training, which is probably the area where we get asked the questions the most. So obviously resistance and strength training is good for the heart, is good for the brain. And when it comes to glaucoma, we've got a hidden risk, which is how we do that type of exercise. So if we're doing something that we call a Valsalva maneuver, which is basically when we're doing a strength training exercise, you're holding your breath, that tends to increase the pressure in the venous system, and that then transfers through to the eye, and it can increase the eye pressure as well in very acute spikes. So holding your breath while you're really pushing or through an exertion, through an exercise, can increase your intraocular pressure and will increase your intraocular pressure. Now, what is the eye impact of that? That pressure is transmitted, as I said, through the veins, and the pressure can often go up to more than 10 points, 10 millimeters of mercury. And that, if done consistently and depending on the amount of nerve damage you already have, can significantly impact the nerve. So we always I always talk about Valsalva maneuver and holding your breath. So essentially we want the patient to exhale while you're doing the flexion or whatever it is, the strengthening component of the exercise. So always breathing in and out without holding the breath. So breathing continuously, not holding the breath, and exhaling sometimes audibly during the exertion phase will prevent that Valsalva maneuver. Now, the dynamic motion, we want to use more dynamic resistance and higher repetitions rather than lower repetitions with a lot of weight. So we want to use less weight and more repetitions. The dynamic movement helps with the ocular perfusion pressure as well. And there's a technique which is normally used guided by a physiotherapist, particularly for injury recovery, that we call blood flow restriction. So that one we don't recommend to be done without assistance, which is basically wearing these bands around the muscle that's being trained. And it can be a simple band with pressure, or even, as shown on the image, a band with a cuff that the physiotherapist will actually increase the pressure. That helps whoever is doing the exercise get the same results as 100% weight that they could carry, or between 80 to 100%, but by only using 20 or 30% of the max load, but doing more repetitions. They get sort of like the same result. So they focus on light resistance exercises with those external restriction cuffs and it partially limits the blood flow. It creates this low oxygen environment that is often used for injury rehabilitation because it promotes muscle endurance and hypertrophy with a lot less mechanical load. The reason why I say this needs to be supervised is because you can overdo it, you can do it wrong, not do it enough, but the main risk is if you actually restrict that blood flow to the point where you're going to get a lot of muscle injury instead. So they're calculating the appropriate pressure that should be done by either a physiotherapist or a personal trainer that is specifically trained for this protocol. Now, so if you're looking at overall what we've discussed so far in terms of resistance and weight training, we can see that the moderate intensity, dynamic resistant training with controlled breathing in and out is a safe and recommended treatment for primary open-angle glaucoma patients, probably for most glaucoma patients, but the studies only looked at primary open-angle glaucoma. Now, if we're doing high intensities of active training, holding a lot of the breath in with the Valsalva maneuver, the eye pressure can go up to 10 points, and we have good evidence that that is a high risk practice. So we want to avoid doing that, particularly if you got advanced end stage or severe glaucoma, or if your glaucoma is progressively getting worse. We want to, and you might be doing a lot of that. That's something that we want to consider. Blood flow restriction and light resistance, which I mentioned, is promising, but it needs to be done under supervision. Now, yoga, where we're going to focus about the postures. So yoga is great. It offers meditative and therapeutic benefits like stretching, muscle lengthening, and also all the mindfulness training that's included in the practice. But specific head down or inverted postures will carry a risk. Whenever we've got the eye level above the heart level, will increase the intraocular pressure. So the lower that goes, the higher the pressure is. That is simple gravity. Whenever we've got positions that the head is really low, the eye pressure can rise significantly. The worst one is probably doing a headstand where the eyes are at the lowest point possible. That pressure can that position can double your intraocular pressure. And it's an absolute contraindication given its extreme risk for glaucoma patients. There are studies that even measure that pressure being 60 in both eyes, while the upper limit of a standard normal intraocular pressure is about 21. Obviously, that position is very hard doing a headstand, but there's a lot of more common positions which, depending on the severity of the glaucoma, we request that you modify your practice. So if we're doing downward dog, which is very common, that can bring your pressure up for about 10 to 15 points. And depending on how much damage you've got on the nerve, if you've got a lot of damage, the nerve is more susceptible to this high intraocular pressure rises. Is standing forward with a band that also rises the pressure, not as much as downward facing dog, but it does increase the intraocular pressure. So we'll focus on modifying those techniques to get a similar result for the yoga practice, but not compromise the intraocular pressure. There's a few poses that are lower risk, which are very acceptable with caution, particularly for people with end-stage glaucoma. We've got to control the breathing, but a plow pose brings the pressure up as well, but on a lower degree, about 4 to 7.5 millimeters of mercury, where we have, even though the eyes are above the heart level, you can see on the photo how they're pretty close and the eyes are looking up. A good replacement position for downward dog and inversions is the legs up the wall pose, where it will only increase the pressure for around 1.6 to 2.8 millimeters of mercury. Again, because the eye is remaining at the eye level, at the heart level. So looking at that again, the headstand is the worst. It can double the pressure rise. Downward dog and plow pose will bring the pressure up, and legs up the wall is the safest out of those positionings. Now, what's the recommendation in terms of activity for a glaucoma patient for those? So headstand, it's normally an absolute no-no. Downward facing dog requires modification. Again, the more advanced your glaucoma is, the more this applies to you on earlier stages. If you're not progressing, you might, and you're not practicing yoga that often, that might be acceptable. But this is a standard rule without any individual advice. We want to modify downward dog. We definitely don't want to be doing Valsalva maneuver. We want to exhale whenever we're doing the exertion, and don't do any breath holding. So modifying the practices with legs up the wall or using props in chairs, as well as focusing on the breathing and the meditation, that's going to help your yoga practice if you have glaucoma, particularly if you have severe glaucoma. Breathing and meditation, mindfulness in particular, has shown to reduce significantly the eye pressure. This study done in India looked at patients with advanced glaucoma that were about to go for glaucoma surgery, so quite severe. And they've divided in groups that they just monitored, and another group that they went through 3 times a week. For 3 weeks rather, they did every day 45 minutes of meditation, of mindfulness meditation. In that group had a significant lowering in the intraocular pressure. They've also done some epigenetic studies on those patients. So looked at the expression of the genes, not the genes itself, and noticing upregulation of neuroprotection on those genes and downregulation of inflammatory genes, which translates into the meshwork in the eye, which is the drainage device of the eye, working better to drain more fluid and lower the intraocular pressure. So meditation was quite beneficial. So we do recommend that, particularly for patients that already sort of like do it or might have that in their culture, that they go do mindfulness meditation, and definitely continue practicing yoga, but with adaptations. There's a few breathing techniques now that we want to focus on avoiding, which is the bellows breath, which you got as high force techniques where you really breathing quickly to sort of like increase your blood flow and get you like ready for a workout, or staying in a little bit more alert, particularly sort of like in the morning, that we want to avoid, because it can bring the intraocular pressure up. There are other safe breathing techniques, including alternate breathing through the nostril. So we're always exhaling and we're not holding the breath or increasing the venous pressure in the body. So that's a safe practice. Essentially, summarizing, the main overall advice for exercise, we want to make sure that patients, particularly the ones that aren't doing anything, are starting doing some aerobic sessions 3 to 4 times a week for 30 to 45 minutes. That immediately lowers the pressure after the exercise, and it has a continuous benefit through that. We want to restrict some inversions if you do a lot of head down posturing, and all those mechanisms that we use for yoga that translates to Pilates as well, whether that is mat or reformer Pilates. We want to keep breathing through the exercise and avoid or modify some of those inversions. We want to monitor the resistance. So we want to make sure the breathing is correct and we're avoiding Valsalva for everybody. But the most important thing is definitely discuss that with your doctor, your optometrist, whoever's looking after your glaucoma, because it's very variable depending on the severity of your glaucoma, your age, your current sort of like exercise practices. But we know that exercise overall is very good, and you should be doing that. We should be encouraging everyone to be doing that. Thank you very much.
Thank you, Bernardo. Some great tips and tricks there for our community. It's wonderful. So it's really clearly outlined what patients should and should not be doing when it comes to different types of exercises in glaucoma, which is great. And I guess we all understand the positive impacts that exercise can have on our general health. And I guess your guidance has been very invaluable in helping patients understand the safe practices that they're able to do in different types of glaucoma that they have. Who knew that mindful meditation could reduce your intraocular pressure? We could all do a bit of mindful meditation at this time of the year, I think. So,
Absolutely.
yeah. The silly season approaches.
Exactly.
So,
and I'm still on hay fever season. That's why I'm very croaky. So I do apologize, but hopefully that was understandable.
It was very understandable. So thank you
Good.
very much for making it quite clear to our community. We would like to now invite our audience to submit their questions. But before we do, I'd like to note that Dr. Soares' responses tonight will be general in nature. He's unable to offer specific advice on individual cases, as he does not have access to your personal eye health results and or your medical history. So let's have a look at what we have from our general community. So we have a question from Christina. I have closed angle glaucoma, but the angles have been open since having my cataract surgery in both eyes. My pressures are now normal. There has been damage and RNFL thinning in the left eye from past high pressures. I love yoga, and I was hoping I would now be able to resume downward posture. And I have a rebounder, which I haven't used for 2 years. Do you think I can now safely resume these activities? So that was a question from Christina.
Good question. So Christina had angle closure, and now she's had cataract surgery. The angles are open, but that doesn't mean that her glaucoma is fixed. She's already had damage on the nerve, so she will always have glaucoma, but that glaucoma might not get worse. Now, when she's doing exercise, when she's doing yoga, her pressures will go up if she's practicing those postures. But again, it depends on the level of damage. If she had a little bit of damage and now that's being stable, I would say she could probably resume that. But I would probably, when she resumes yoga, I would monitor her a lot closer, between so like 3 to 4 months or 6 monthly at least. Make sure that she's not getting worse around that time, because she should be stable after she had her cataracts done. So I'm assuming she's stable. She can go back to yoga, but monitor closely. If just by adding the yoga practice, she's at risk of the glaucoma getting worse, so it's not completely safe, I'm going to go back and forget it. You can go back, but I would monitor her closely. If she does start getting worse, the yoga might be the culprit, then I would sort of like definitely contraindicate the practice for her. But I like understanding that, in her case in particular, she loves yoga. Some people have certain activities that are critical to their mental health. I'm very flexible in terms of having a conversation. That's why we mentioned it. It's important that you have that discussion with your doctor, particularly in Christina's case. But yeah, a lot of caveats there. But I personally would not have a problem with her going back to yoga, and that would be my approach.
Great answer. I think, it's really important that the patients do touch base with their treating ophthalmologist or an optometrist if they're making any changes in their life, just so that the doctor is aware and can advise them accordingly, depending on the type of glaucoma and the progression of their disease. So yeah, great answer there. Marie has a question. I do a few different exercises, lunges, planks, and an exercise arms out straight on the table, bending over, head between arms and horizontal to arms looking down. I hope you got that. Are these safe?
So lunges are safe. The arms, which is almost like, I think what I understood she's doing is almost like a child's pose with her hands on the table. Her eye level is still below the heart. Even if she drops her head, that should be at heart level. So that one is safe. Now, planks are also safe. She's horizontal. The pressure does increase slightly more than when we're just lying down sleeping. If you're sleeping with, sleeping on your back. So if you belly down, the eye pressure slightly higher, but it's still that sort of like a safe approach. It's important that she's not holding her breath while she's doing the plank. She's got to breathe normally. But yeah, go Marie.
Go Marie. Well, we have another question from a Marie. I don't know if it's the same Marie or if it's a different Marie, but is swimming okay as it has the head essentially horizontal to the body and looking down? What are your thoughts on that?
Being a swimmer myself and having a family history of glaucoma, luckily I don't have it yet, maybe. But swimming definitely safe. Swimming is a great exercise, horizontal, similarly to what we discussed with the plank and sleeping. There is, because you're horizontal, the eye pressure is higher than when you're standing up, but that is safe. The important thing with swimming is the type of goggles you're wearing. You want to avoid the competition goggles, which are quite small or they're really, really tight, especially the ones without a rubber that will sit on your eye. So if you feel like that's pressing against your eye rather than against the orbital rim, which is the bony structure around your eye, and obviously, faces are very different, and goggles should be sort of like, fitted as best possible to your face so you don't have water coming in, but you also don't want too much pressure in your eye for that. Just make it tight enough and not too tight. You don't want to sort of like come out with all those marks and like a sore bruise around the eye there. That's probably a little bit too much pressure, especially if you're swimming for a long period of time.
I mean, swimming's great, but yeah, a lot of people don't know that swimmers' goggles create suction and possibly a spike in pressure because it creates that suction. So yeah, it's really good that you informed. And you can buy those goggles that encompass the orbit at any local sporting store. So they're readily available as well. Karen would like to know alternative moves instead of the various head down moves.
Oh, we covered those.
Covered that. So yeah.
Well, basically, sort of like a lot of you can use things to adapt the chairs or the wall and different things like the legs up, but just basically focusing on those modifications would be good, which I'm sure structure can help you with.
Tico has a question. It's in regard to bracing, especially for abdominal bracing, which is in regard to weightlifting and a need to hold my breath throughout repetition. What do you think about the abdominal bracing when lifting weights? Do you know much about that?
So holding your breath, you're always going to increase the pressure, particularly if you're doing, pushing when you're doing that and you're holding your breath for the strength. The bracing does increase the abdominal pressure, particularly if you're doing that too tight. That's good to support the lower back during exercise, but it can increase your pressure as well. So depending on the level of glaucoma, that is one to avoid. That can bring the pressure up quite a lot, similar to Valsalva maneuver. So bracing, and what I mean by bracing is you actually using a brace or a belt around the belly to sort of like support when you're doing like quite heavy lifting. That's depending on the level of glaucoma, and I mean levels, like the worse it is, the more you want to avoid that.
I guess he's bracing to, avoid any injury. However, you're causing possibly a different problem. So, you really need to be, mindful of that as well.
And depending on the level of glaucoma, Natasha, like if you're needing to do bracing for weightlifting, you're probably doing a very heavy load. Or you're working through some injury. In that case, you might be doing high repetition, which is safer, but then you don't want to have the brace tight, just enough to sort of like support you. But if you're bracing to do heavy weightlifting, there is a high risk of getting pressure spikes and potentially damaging your nerve.
Well, speaking of injuries, actually, what are your thoughts on patients who need post-injury, like remedial massage or recovery at a physio when they're lying face down and receiving treatment? What are your thoughts on that?
That's a good question, because we're talking about, people facing down on that massage chair where they've got their head sort of like, inside a hole. Depending on the positioning that you've got, even though you're lying down, we've discussed that that is safe. If you're getting a lot of sort of like neck or upper back treatment, and the treatment giver is applying a lot of pressure in your eye, sometimes you come out with sort of like that mark under. You want to make sure. I've had some patients come out of a massage treatment with sort of like temporary transient visual obscuration, was like the vision, you get a bit of dark vision, similarly to when the blood pressure drops. If you stand up too quickly, you get sort of like a direct effect that does bring the pressure up. So you want to make sure that that you do need treatment, that you're supporting again the bony structures of your face and not the eye in direct contact with that. So positioning is really important when you're actually putting your face in the hole. You want to avoid direct pressure in the eye.
Yeah, I think that's really important. Yeah, that people are aware of that, because I don't think many people, consider that when they go for massage. Yeah, or a risk, in having their glaucoma becoming worse. We'll probably answer one more question. So this one's from Rajiv. It's in regard to meditation. So meditation, often one holds a deep breath for 5 seconds, also fast breathing for 5 minutes. What is the impact on glaucoma for advanced glaucoma patients in this case, Bernardo?
So in meditation, holds a deep breath for 5 seconds. 5 seconds is sort of like a short amount of time to hold the breath. You're not holding the breath and exerting yourself, so that should be safe. Now, fast breathing, so like for 5 minutes, we sort of like, that depends on the technique. If you're just doing it hyperventilating, so it should be fine. But if you actually have sort of like that practice, that has shown to increase the eye pressure. So I would be cautious of the fast breathing, particularly if you got advanced glaucoma. Now, Rajiv also asked, he does intense lap swimming 3 times weekly, which is good, and has advanced glaucoma. I think we talked about the goggle choice for that, but swimming is a great exercise. Yeah. So goggle choice for that, but continue swimming. Yeah.
Fantastic. Yeah. Great answers. Yeah, thank you very much. So I guess in the essence of time, there are these are the only questions that we're able to answer during tonight's presentation. If you don't get an opportunity to have you answer that question answered tonight, please feel free to direct your questions to glaucoma at glaucoma.org.au, or you can phone us on 1-800-500-880, and we will endeavour to answer any questions as quickly as possible for you. Glaucoma Australia has 3 orthoptic patient educators on staff, Lauren, Val and myself, and we welcome not only the questions from tonight's topic, but also any questions that may arise on your glaucoma journey. Tonight's webinar marks our final session for 2025. We would like to thank our speaker, Dr. Bernardo Soares, for his wonderful and informative presentation on glaucoma and exercise, as well as all our previous presenters for their contributions throughout the year. We also extend our sincere thanks to you, our viewers, for your ongoing participation, support and interest in our webinar series. We'd like to wish you all a happy and safe festive season, and we look forward to reconnecting with you in 2026. Thank you and have a good night.
Thanks so much, Natasha, and thank everybody on Glaucoma Australia. You guys do a wonderful job. Hopefully I don't send you too many patients, but I send everybody your way with information sheets and everything, and you do a wonderful job for the community overall. So I use all Glaucoma Australia resources, and I'm happy, and I'm thankful for the institution and happy to support you in any capacity at any point.
Thank you very much, and we accept all your patients, of course. Thank you.
Thanks.